Good afternoon, everyone, or good morning if that's where you are. Welcome to today's webinar on the role of service coordination and services during the pandemic. This is the third in a series of webinars co-hosted by the Joint Center for Housing Studies and the Hastings Center related to findings from our joint report, Advancing Housing and Health Equity for Older Adults, Pandemic Innovations and Policy Ideas. You can find links to the report and the recordings of the two previous webinars on our website. After today, the final webinar in that series will focus on changing the narrative around housing, aging, and health, and that will be held on December 8th and hosted by the Hastings Center. Information on that webinar is on both of our websites, the Hastings Center and the Joint Centers. I also want to note that the Joint Centers research webinars will close out this fall on December 2nd with my colleague Carlos Martin, who will speak on keeping the decarbonized lights on, U.S. housing equity and the energy transition. You can find more information on the Joint Centers website. And just turning to today with a little bit of housekeeping, you can send questions using the Q&A feature, and closed captioning is available at the bottom of your screen. We will be recording today's conversation and we'll post it on the Center's website by early next week. So with that, I'll begin. In our recent report, Advancing Housing and Health Equity for Older Adults, we explored solutions for supporting low and moderate income older adults during the pandemic who were living in conventional housing and in the community, as well as in subsidized housing for older adults. And today's panel is focused on the latter. Many of these settings provide services directly in-house to residents or employ service coordinators who help link residents and services in the community. During the pandemic, staff and particularly service coordinators were able to pivot and draw on relationships and resources in the community to support older residents. This wasn't without challenge and often required a great deal of creativity, which we'll talk about. But on a larger level, the pandemic experience showed the immense value of providing services where people live and also underscored the uniquely valuable role of service coordinators. I'm very happy to be joined today by Amy Schectman, President and CEO of Two Life Communities, a provider of service-enriched housing in the Boston area, Leslie Whiting, Health and Housing Program Manager at the Seattle Housing Authority, and my Joint Center colleague, Samara Scheckler, whose research focuses on the integration of services in housing. I'm going to turn to Samara first to help us set the stage for today's conversation. So, Samara.
So much, Jen. So just as the older adult population is growing nationwide, the residents of affordable rental housing properties are also trending older. As we age, we're more likely to experience physical or functional limitations that make us more likely to need support to live independently. This might look like periodic supports like transportation or help with financial management or laundry. It might look like daily assistance, help with meals or dressing. So supports can make it possible for someone to live safely in their home longer. Today's conversation is going to focus on federally supported multifamily housing for low-income adults who are at least age 62. In 2021, residents of these households had an average income of about $14,000, and roughly 40% of these residents were assessed by HUD to be frail or near frail, which means that they needed help with at least 2 activities of daily living. Again, that's dressing or bathing, transferring out of their chair. But services available to these residents are limited and they're patchy. These age-restricted affordable housing unit, they offer apartments, but they don't necessarily include assisted living services. Some states offer supports through Medicaid and other state funds, but financial eligibility doesn't align with eligibility criteria for the subsidized housing. So residents living in these affordable housing units might not qualify for personal assistance programs. And also many states offer long waiting lists. They operate long waiting lists for these services. So even qualified residents may not receive them. So many older adults of the properties we're talking about today will rely on families and friends for at least some of their supports. They also rely broadly on community services in the region and public programs that help meet needs like transportation or nutrition. But there's no coordination among the various programs and services that individual residents might use. In the mid-90s, there was a new program created, so properties that were designed to house these older adults and people living with disability, these properties could hire a resident services coordinator. This person was charged with assessment, monitoring, and coordinating the many programs and services that support a resident's ability to live independently. In practice, the resident service coordinator develops relationships with residents and their families, as well as with community organizations and public benefits managers. On some properties, there might be other staff who are available to assist residents periodically, but the service coordinator is unique in that the role involves proactive outreach to the community and the services available to all residents. So the service coordinator has the ability to assess needs property-wide and reduce or minimize the fragmentation of services. However, these services are not mandated, and some properties can't afford to hire them, or they don't offer them for other reasons. As of our last reliable estimate, only about half of properties designed to house older adults had a service coordinator working on them. Many affordable housing properties are not eligible to hire a service coordinator because they house all age residents, but even on those properties, there will be many older residents who don't have access to a service coordinator. So as we talk today about the value of housing-based services, just keep in mind that there are a lot of residents living in affordable housing who don't have access to these services.
Thank you so much, Samara. That's great. Leslie and Amy, invite you into the conversation, and I was going to start with Amy. If you could share a little bit about the community of Two Life and how you all responded during the pandemic to support your residents.
Gladly. Thank you so much. I just love the work the Joint Center does. It's been so helpful over the years. So let me just start with who we are. We operate 6 campuses of deeply supportive, affordable housing. I'll warn you, I'm a zealot for what we call aging in community, and we believe that every older adult by right should have the opportunity to live a full life of connection and purpose, and we do it by creating dynamic, supportive environments with a laser-sharp focus on affordability, meaning we go where the market fails. On our 6 campuses right now, we have 1,320 apartments. We've got 210 in construction, 220 about to start construction in 2023, and 250 the next year. So we're expanding because, as you mentioned, the waiting list and the lack of availability, and it doesn't work this way, we know that, but if you just simply took the number of people on our waiting list divided by the amount we turn over every year, it would take 26 years to clear the waiting list. So you can imagine being 78 and being told only 26-year wait. And you mentioned the 14,000, our actually median annual household income is 11,568. That's our baseline. I'm happy to answer more questions. When the pandemic hit, we had a 3-pronged approach, if you will. 1, information sharing, 2, partnership, and 3, rapid action. So it's hard to remember back then, but back then we were getting like, one doctor said this, one public health expert. It was just a flood of confusing information. And so we saw it as one of our jobs to curate the information and get it out there as best we could and try and provide a reassuring sense that we were staying very much on top of all the information. The partnership was twofold. I know your report talks a lot about partnership. So there was partnership with organizations in the community that we rely on, and partnership with our residents. Early on, we decided it felt enough like things are happening to you, and we didn't want to make it feel like we were also happening to you. So instead, we invited all our residents to become community heroes. And that meant staying in your apartment unless it was absolutely necessary and following all the protocols if you couldn't. And if you did, we had an artist design a beautiful placard for your door, defining you as a community hero, helping to save your neighbors, yourself, and the staff. And that brought them in as our partners. And the third was rapid action. Early March, we closed our doors to outside visitors. I remember having a conversation with colleagues who said, "You can't do that. HUD doesn't allow it." And I said, "Let him sue me. I don't care. There was a lot of devil may care kind of decisions we made. So those were the 3 buckets. Really quickly, what we did was we decided to provide everything someone would need to honor that partnership of staying in their apartments. So meals, food from grocery stores, laundry, mail. We did everything for free. And it was an important decision because we thought that would, given the low income, it would give people incentive to take advantage of it. And we provided everything you could need. And very importantly, and this is where I'll end because I'm sure you want to get on, resident service coordinators played a key role. By the end of the second week of March, we had a massive spreadsheet where every resident had been contacted to find out whether they needed things, whether they wanted things, what they were worried about, and how often we should check in. Some people said, please don't keep checking in with me, I'm fine. And others like, yeah, every day a good check-in, that would help. So we knew what people needed and built that statement. And then we could do collaborative things. Either we can talk later in hallways on Zoom and stuff like that. And in the end, I think we did pretty well. The first year before vaccines, we lost only 1% of our population, which 35% is over 85. So they were the high risk group. And of that 1%, not a single person died from getting COVID to life. If they went to the hospital for a heart attack, they got COVID there. We didn't transmit it within to life. So we consider that a pretty big success. And happy to talk more, but I'll stop there.
Yeah, thank you, Amy. Leslie, you work in quite a different environment. You're in Seattle and just at the Housing Authority. Could you tell us a little bit about what it was like there at the beginning of the pandemic?
Yes. Hi, good morning, everyone. So at the Seattle Housing Authority, we actually have over 100 properties across the city of Seattle, over 30,000 residents total. And when we look at those who are 55 and up, that is 10,000, actually over 10,000 of our residents. So a significant number of our population are those older adults. And they actually live in our high-rise, low-income public housing or in our senior housing, which tends to be smaller 1 to 2 level buildings. And about 6,000 of those 10,000 are disabled. So that becomes another factor in considering services. And they have an average income of about $14,000 annually. So when we think about our response, we have to take into consideration all of those factors, that they don't necessarily have family supports. They don't necessarily have the income to reach out for other things. So there is lots of community partnerships. There are things that we went kind of above and beyond the role of being a houser to provide, such as some of the same things that Amy mentioned, in that we had to make sure that people had food. There were food drives and clothing. We have some community partners who offer services, who helped us to do wellness calls to residents, to call around and find out individual needs, which is a lot of work when you serve this many people, but we did that work. We have community builders who are assigned to each building, who help residents to support them in what they see that they want in their individual building. We've also, I think this was a big trigger in us as a houser doing more for health in general. So my role actually did not exist before the pandemic. So becoming a health and housing program manager, that is a role that became important. One of the community builders was actually pivoted to being the person to run the vaccine clinics for residents. And we've had many residents who said that they would not have gotten a vaccine if it were not specifically brought to the houser. And I think that's related to not just access, but also trust in the community. We serve a very diverse group of people. And although there's an idea of what Seattle looks like, our housing community is actually extremely diverse. I think we have over 100 languages spoken. So also trying to get culturally competent services and language services provided is a whole other layer in providing access to the services.
Leslie, can you describe the community builder? Is that someone who's on staff with the Housing Authority, or just say a little bit more?
Okay, so community builders are actually staffed by the Housing Authority. They're a part of our community services division. So they are assigned to different types. Some are in our family communities, and then there are a couple who work with the low-income public housing, those high-rise buildings, and then there's one specifically assigned to senior housing. So what they do is actually work with residents to help support them in what they have actually advocated for. So residents have a say in saying, okay, we get, so in our high-rise buildings in the senior portfolio, they get resident benefit funds, which are allotted based on like so many dollars per resident. They can get together as a group, they can have a council, and they can say, we want to have a holiday party. They can say, we want a new TV. They can advocate for, we want exercise classes at our building. And their community builder is our assigned staff person who helps them get the services that are meeting the needs of that specific community.
Okay, great. I want to just underscore what Amy and Leslie both said about the vaccine access, because I know that that was something that you both worked very hard on. And in our report, we have an example from Toronto too. So just a shout out to our colleagues in Toronto who conducted outreach with 15,000 tenants and connected them later with door-to-door COVID testing and vaccination. So important. And I think that comment that it wouldn't have happened, people wouldn't have gone out to get it were it not for that. So that's really terrific. Samara, I want to turn back to you. We at the Joint Center conducted a survey of service coordinators a couple of times during the pandemic. And you have a blog up today on our website sharing insights from that work. So everyone can take a look at that. Can you just share a little bit, what did that show about how service coordinators themselves had to change what they were doing during the pandemic and why they were effective?
Yeah, I should start by saying that we really value the partnership of the American Association of Service Coordinators in helping us design and conduct these two surveys during the summer of 2020 and the last months of 2021. So we were able to hear directly from service coordinators and get a sense of what was going on the grounds. We found that during these peak pandemic months, service coordinators were really acting as access points, the pivotal points of information and transfer of information. I'll give a couple examples of that role, but I want to make sure that we are all thinking about the world in 2020 when our first survey was conducted. In the summer, we were still figuring out how to stay safe from the virus. We'd recently been washing groceries. The CDC had shifted position on mask wearing, and we really didn't know if there was a vaccine on the horizon. So older adults, as far as they could see, were isolating indefinitely. There were recommendations still emerging, and there was a lot of competing information flying around. So one role that clearly was elicited in our surveys were service coordinators stepping in to interpret and communicate information in real time. So they use their professional networks and their contacts with local government organizations to gather these emerging public health recommendations, and they worked with property management to implement changes to policies and procedures, literally rearranging spaces, communicating new guidelines to residents and to their families and professional supports. They were really just the nexus of information that everyone kind of turned to at that time. They also made sure information was packaged in an appropriate way. So they were the ones who were to account for non-English speaking residents or residents with poor hearing or low vision, little access to technology. They were excellent messengers in part because they had relationships that were built before the pandemic, and they knew how to communicate with residents and their families and supports, and they were trusted as sources of information. So both of our surveys in 2020 and near the end of 2021, service coordinators acting as a bridge between residents and community programs and resources. They were well positioned to cultivate partnerships and tailor supports to the property level needs. So this work involved assessment of both individual resident experiences and also property level circumstances as needs evolved over time. They identified relevant service providers and supports. They cultivated collaborations with providers and programs, and they worked with residents to ensure that everyone had access to the resources that providers were offering. So I'll give an example of this happening on the ground. Residents became much more dependent on programs to get food during the pandemic for obvious reasons of not being able to leave their apartments. One of our respondents noted low participation in a nutritional program. They checked in with residents and learned that the meals weren't culturally appropriate for the residents of that property. And the service coordinator was able to work with the program providing the meals to design options that were better aligned with residents' dietary needs. And they closed the loop then and increased resident engagement by then explaining the changes being made to the residents and convincing them, to give the program another shot. So they were able to kind of have that iterative role. During the pandemic, there was a lot of instability. Needs were significant, and service coordinators, as we found, were just generally well positioned to gather and share feedback, solve problems on the fly, kind of bring them down to the point of the resident and the property, and boost the efficacy and the effectiveness and the efficiency of the programs and services that were available.
Thanks, Samara. Yeah, I was really struck in the surveys that we did of the creativity that was evident in the work of service coordinators, just how imaginative they got in terms of a lot of this. And I want to go to one thing in particular, which is we're talking a lot about the practical things of getting food and medication, but the isolation was isolating and lonely. And Amy, I wonder if you could speak to that, sort of how you had to pivot. And I think, again, there was a lot of creativity here.
Yeah, that's absolutely right. And we had identified by the end of week one that connection was going to be a critical piece of it. So it took many forms. Like one, as I mentioned, we had resident service coordinators calling every week, unless they asked not to, all our residents. So we were always in touch. We quickly pivoted on the digital stuff. We bought a whole bunch of, I forget what they're called, things that come preloaded where it's easy to touch and get on the internet, and began by week two offering internet coffee hours and our fitness. By week one, we had our fitness classes online. We have our own television station. So we did all that. But then we also, even that still leaves short. So we did things like hallway trivia contests where everyone would sit in their doorway, because our hallways are at least 8 feet apart. So you could sit in your doorway and then someone would come up and play games. And so you could see each other, and it wasn't quite as isolating as it would otherwise have been. So we did our best to have the kind of some live and some, and of course, the minute it got warm enough, we had outdoor walking clubs and concerts. Oh, that was the other thing we did a lot of. We had concerts in the courtyard, so everyone would stick their head out the window, even in the winter, and scream at each other and cheer. And so we did. It was hard, but we had something going on every week at every site to keep people engaged and to be constantly asking what they needed to make sure we stayed engaged with folks.
I want to ask Leslie if you'll talk about some of the challenges of doing all that. I know a big part of this is funding, and we're going to get to funding right after this, but other non-funding related challenges of being able to do so much in such an uncertain and short period of time.
Yes. So for us, some of those same issues with isolation were big, and those wellness calls that we did help with keeping in touch with residents and identifying needs as we chatted with them one-on-one. I think with some of the things that Amy mentioned, a big thing is technology. During the pandemic, we shifted to a lot of things being virtual. And especially when we're thinking about our older adults who may not have devices, who may not be as tech savvy, that can be really challenging. So, we want to engage. We actually received other grant funds to do some digital equity work where we were able to give more laptops to houses. And now we actually have more digital literacy classes that are ongoing to help support people be able to access telehealth or other activities, online and stay connected. And that is actually a very big part of giving people that access and that connection to community in the best way that we can. I think another thing is that we talk about residents being isolated, but another big issue was staffing. We had new policies around vaccination status or just people's personal comfort or for health status reasons who left the agency during that time. And that is something that we are still recovering from. And I think another thing that is a big factor is that cultural competency piece, and that when we do have people go out, we need to meet the needs of our residents. We have a large Asian American community. We have a big African immigrant community. And we have added additional service coordinators who target certain communities, or making sure that they have staff on hand who are, speaking those languages or looking like the people that they serve.
Could I add one thing, Jen? So I think that your point about the digital divide is important. That was one of the places young people in the community were really helpful, but getting on the phone and being really patient. And so we have now a whole cultivated group of young people who are now in person helping people out. And I think that's important. Also cultural, we translated everything we wrote into 9 languages at all times. But I just want to make one other point. Just before I forget. So the young people that came in, it's not only for our residents, it's also for them. Samara, you did a beautiful job of talking about frailty and what happens and needs for stuff. But so as you age, that does happen. But as you age, you also continue to accumulate wisdom and beauty and thoughtfulness and experience, and being able to transfer it to the next generation. When you remove the barriers to living on a day-to-day basis, our older adults can be beautiful mentors and teachers, and that's really an important goal of all of the things we're doing. Just wanted to add that.
Appreciate that. We have a question in the chat about the shortage of caregivers. Well-known challenge. Certainly the pandemic affected caregivers deeply. And the question is about the hiring, retention, and staffing of service coordinators and others involved in on-the-ground services, which I think leads nicely into our conversation about funding. So, Leslie, I want to start with you. Can you talk about how the authority is able to provide services? What kind of funding is available, and how do you do that?
Okay, so the funding of services is very difficult for us at the Seattle Housing Authority. So, we are a HUD-funded houser, and the priority of the agency is to keep people housed. It becomes challenging because anytime that we add additional services, that means that we are, kind of making that hard choice of providing less actual housing units. One of the good things at Seattle Housing Authority is we have the moving to work designation, which gives us some flexibility in offering different services that other housers across the nation do not have the ability to do. And we are growing in the services that we offer, but I will say that currently the service providers that we have are all contracted. So there's the layer of dealing with, putting out those RFPs and finding qualified contractors to provide our services that are, familiar with our community. I think now a big challenge has been that, like I said, we serve 30,000 people. We are not able to find one consistent contractor that could run all over the city. So we have, in a way, kind of piecemeal contracts to try to serve different pockets, and they each have a different target group. So it continues to be a delicate balance. We're pursuing other grant opportunities, which is also hard because when you are a houser, there's an expectation that you provide the housing, and those funding dollars, when we look at who is eligible for some of these other grants, it's not housers. It is, they expect that, well, you can go to healthcare providers and you can go to community organizations, and why can't your residents just go a mile up the street to a food clinic or I'm sorry, a food bank or what have you, but that is not necessarily reasonable for the population that we serve, especially when we're talking about older adults. People need services where they are, that can meet them and that can understand them. And it is just very challenging to get people to move outside of the community. That's why it's important that as much as we can bring in-house, although we are not technically a supportive houser, you know, we do look at those models and try to bring as much as we can directly to the community.
Thank you for drawing that out. So sort of one thing that we've talked a lot about in the report is this sort of mismatch between housing and care. And so you've just sort of, I think, talked about it on the organizational level of housing does housing and the care happens somewhere else and people need to find their way is sort of the assumption. Amy has talked about this on an individual level of you might be eligible for housing subsidies, which we know does not mean that you are likely to get them, because in this country, it's not an entitlement and we only serve a third of older adults who are eligible for them. But once you do that, you may not be eligible for the services. So, Amy, could you expound on that a little?
Sure. Thank you so much. So I want to make one point. In the olden days, which is simply before the year 2000, the housing programs of the federal government called Section 202 actually did provide for a match of eligibility on the services and the housing side. And because everyone paid a third of their income in rent, we were able to serve that extremely low income. And our population from the olden days, anything built before 2000, in fact, are eligible for, in this state, what's called long-term services and supports. And so our coordinators play this pivotal role of making sure it happens. And we organizationally play a role of negotiating deals to make that happen better. In the new way of building housing, which is called low-income housing tax credits, it only serves what's considered between 45 and 60% of area median. And the significance of that is eligibility for services stops at about 40%. So you've got people who are eligible for housing support subsidy, great. They're not eligible for Medicaid, food stamps, long-term services and support. And it's this gigantic misalignment in public policy that, just like what Leslie was talking about, so finding a way to get them services there's no public way to do it. And so we've got to do fundraising and we've got to do negotiations and we've got to have people who, we've got such a big population here that's eligible for your services. Can you stick those people in? And so that's a very big problem with the biggest source of creating new affordable housing in this country. It totally misaligns. Then you've got the next group up too, which is people who earn what's more than 60% of area median. Again, these things are not that significant, but what it means is you're not eligible for housing support, but you don't have enough money to pay for it on your own. So you're totally without housing or any of the other supports. And those people actually are big ones at risk for premature nursing home because they run out of funds. And so Massachusetts, with high housing costs and high care costs, actually has the highest rate of nursing home placement, not because we have more people who are frailer than in other states, but because people run out of money and the only thing the government will pay for is that. It's hardly inefficient. My last sentence, I promise. It costs the government about, in Massachusetts, about $140,000 per year to take this person that we are handling right now for about $15,000 per year and have them in that nursing home. So it's inefficient use of resources. And before the pandemic, 90% of Americans said they'd rather die than end their life in a nursing home. And I don't know what the new numbers are. I guarantee they're higher than that now. So it's inefficient. And we've just created these ridiculous gaps in alignment.
Great. Yeah. I'm beginning to think about, we talk a lot about aging in place or aging in the community or however you define it, but we often focus on the house, but you also need the services to stay in that house. So just, not to put too fine a point on it. There was a question early on that I think come in here is how developers and property managers are incentivized to provide these services. And from Amy and Leslie, what you're talking about is this challenge of pulling these monies together, these grants and different ways. Are there incentives, and what would an incentive, where would you go with that?
There are not incentives, there are disincentives, in fact. Although I will say in Massachusetts, I got to give us a little bit of credit. One of the things we decided about 8 years ago was we were going to make a big stink about resident service coordinators. And when we started in our growth business, you weren't allowed to include resident service coordinator in your budget, what's called above the line, which means it counts for your funding. And so for years we had to put them below the line and find philanthropy to do it. And after a really big push on our part, I'm very proud to say the Department of Housing and Community Development in Massachusetts not only agreed that we could keep RSCs above the line, it's now a requirement for all new affordable housing built with state money in Massachusetts that a resident service coordinator is integral and is required. So I'm very proud of that change. And that's the one really good incentive, because you can't get any funding if you don't do that. But the next level, it takes an enormous amount of work, time, energy, and effort. The only incentive, if you will, is it reduces turnover, and turnover is costly. But I feel like we're pretty much on our own, tilting at those windmills by ourselves. And COVID really exemplified that. We got no support from the state for anything we did for the entire time at COVID, and in fact had to pull together other housing providers even to get the vaccines to come into our housing. And we got no testing at all. And so we had to partner with MIT and entrepreneurs to use ours as a beta site. So I'll stop there. But no, I don't think there are any incentives. I think there are disincentives.
Yes, and I can say, now I will preface this by saying I'm more familiar with services than I am with tax credits. But another thing is our buildings are also older. And that becomes a challenge in wanting to serve people in the way that you want to, and to keep them in an environment that is healthy and safe. When we transition to wanting to redevelop or remodel buildings, switching to that tax credit model is something that provides that income to be able to do that. And that is a trade-off. And I think that is why it's important, like Amy said, that at the policy level that we also include, okay, if we switch to this, we still need to set the standards for the care of our residents who are now living in these tax credit units.
And Leslie, while we're on, I wanted to go back to something you said before, because I'm conscious of the fact that our audience today is coming from all sides of this equation. So you mentioned moving to work and how that provides some flexibility for Seattle. Can you just expand on that just a little bit?
Okay. And I also identify with the folks who are not housers, because I recently came to the Housing Authority from having a public health background. So I'm still learning all of the terms, but basically most housers focus on housing, and they do have to pursue other outside partnerships or funding or what have you to be able to provide any services to residents. Seattle's moving to work designation allows more flexibility in that we can actually fund more things that other housers are not able to do. So things like service coordination and these other activities that support this quality of life for residents is something that we have more flexibility on. And it is something that I wish all housers had access to, but that is a great benefit of being here in Seattle.
Thank you. I want to go to, we've been talking about services inside of senior housing or housing explicitly for older adults that is affordable to people with low incomes. Are there lessons here for providing services from that base into the neighborhood? Is this something that, given all the constraints, it seems like that's, again, another ask on top of constrained budgets and all that, but sort of the idea of a community hub or something.
Yeah, so we are integrated into the community. I think for some of our types of housing, just the structure of the building can change that. Like I said, some of our buildings are high rise. So what works there is that we carve out space actually in the building in community rooms or offices where service providers can come be available on site. We have other garden communities that include families and people are in individual homes where we have service providers who have offices smack dab in the middle of the community. We have other partners where, we have shared land. So, one of our communities has the Boys and Girls Club right there, who also becomes a partner. And then we have other people who come and just offer things right in the midst of community. Our community builders do not just serve our residents, because when they have a community event, it is open to all. So especially in those neighborhoods, like homeowners come out as well. We've had homeowners actually sponsor events for residents and kids who are just excited to support within their neighborhood. We also are a commercial leaser. So that has given the opportunity to allow resident families to actually open businesses and to have businesses that are reflective of their culture interspersed in their community, other things like daycare. So it is a wide gamut of, what we've been able to do with being right in the middle of community and making sure that we have our service providers actually having offices and space on staff. And as we move forward with redeveloping more buildings, that's something that we consider in every space.
So I would add yes and no. So the yes part is, although it's faded a little during COVID, we're starting to reopen. We've always considered each of our communities a village center, and we invite people to lifelong learning lectures and music and concerts, and we believe in that. And that's good. And it is not the same thing as having resident service coordinators help think about your life. And I mean, we also provide space for what's called the ASAPs, Aging Service Access Points, for public agencies to be in our buildings. And we're building a PACE center on 2 of our campus, which is a healthcare center. So those are open to the public. And I'm just going to be a little controversial here. I think if we want to really think about breaking down those funding silos and being efficient, it's not that we don't spend money on older adults, we just spend it in ways they don't want it. If we are to change that, the efficiency of place-based services is so much greater. And just one little stat on that, the average sort of home care worker at these aging service access points serving in the community can provide 5 to 5.5 hours a day of actual service because they travel. In our building, they're providing 8 hours a day. That efficiency of resource utilization is smart and is necessary if we're really going to change the dialogue and the way. So I don't want to mislead people by, even though we invite people and we hope they come and it's great, it isn't the same. And I would argue really strongly, one of the things we learned collectively from COVID is, I think we have to stop talking about aging in place. I think we have to start talking about aging in community from an efficiency, from an efficacy, from an effectiveness perspective. And so that's where I stand on that.
So I'm just thinking about our folks on the webinar who are living in more rural, low density areas where that is certainly an issue, right? This idea of, especially Amy, you have talked about this before, that those hours of support, they come in chunks, right? So somebody needs help with bathing or housework, that they have to pay for 2 hours at a time when maybe they need 15 minutes or something more than that, Amy is saying. But if you're all in the same building, someone might be able to move from person to person in 15 minutes here, 15 minutes there. But what does this mean for those who are living in more dispersed areas? And there was a question in the chat, if there's enough time, wondering what you all think of Vermont's SASH model, which is supports and services at home, the potential for replication. That seeks, I think, to do service coordination in settings where there are a lot of older adults, but also in more dispersed settings. And I don't know if you have any comments on that.
I'm not going to comment on the diverse settings because I'm a believer that people should The two biggest threats to aging optimally are loneliness and affordability. Both of them are most efficiently and effectively addressed when people live together. It makes much more possible. What SASH does is pretty similar to what we do. I think we actually enhance certain services, and we all know that it creates better health outcomes. That's the SASH study proved beyond the shadow of a doubt, that longer lives, fewer heart attacks, fewer strokes, all the things that are costly to our health system do happen less when you coordinate and support each other and address both the loneliness and affordability at the same time. And I think it's even more extreme in rural areas where things are so dispersed. Then you're going to have 2 hours of service for someone working an 8-hour day. Even more urgent that you bring people together in a place-based strategy.
And I'll say, and this may even be an offshoot of my current role, but I am from the Deep South. I'm from the state of Mississippi, so I definitely understand the rural challenges as well. I will say everyone who is a service coordinator is not a person who does that as their job. There are personal caregivers, there's community, and I think in those rural spaces, there is a different kind of strength in connection that is not formal. And I think, I come from working with community health centers, and I think people working together to show up for community is something that I miss from my Southern upbringing, in that, some of it is different, but it's still the same. It just looks different in those settings, in that people are still very closely tied. People know what is going on with their neighbor, even if in the South, your neighbor means someone who is 10 miles away from you. And I think there are places like churches and community health centers and other just public spaces that become service coordinators. And I think it becomes important to connect with not just the people that you can get money from, but the people who are also willing to just put in some hands on deck with you to help support the community that you have.
Leslie, thank you so much for that. And Samara, you had a thought. Do you want to add it on?
Just a very quick thought that just listening to this conversation today, which has been so rich and interesting, it really makes me think that the idea of an adequate house, which we might typically say is a place that has services like water and electricity, for some residents, really we need to expand our understanding of adequacy to include supportive resources that meet someone's needs to be able to live in that house.
Yeah, I appreciate that. And I think this is something that we also point out in our report about the idea that a lot of times people start where they start, and they need to, go in the door and find that link to the services. And whether we have friends working at Habitat for Humanity, where, people call and their needs extend beyond the physical repair of their home. So how can we link them to these services? There was a question too in the chat about partnerships building on interfaith communities. And Amy, go ahead.
We're doing one right now that I just love. So Deaconess of Abundant Life, which is a Methodist organization in Massachusetts, came to us. They had an old rest home, which I don't know if people know, it's a model. It's really pretty outdated. And it was failing financially. And we went in, discovered that the people living in that really could live in housing with the right kind of support. So won't take you through the multiple year conversations, but we are now rebuilding, again, instead of the rest home, we're building 68 all affordable apartments in collaboration and joint branding with this Methodist organization called Deaconess of Abundant Life. And it feels really wonderful. My favorite moment, I'll be quick, is the CEO there is not a real estate person. He comes from the care business. So asked me to come to his board meeting to please explain how real estate transaction like this could work. So I did, but when I got there, they have a minister on staff. And in honor of me coming to present to the board, she had written a special prayer for this collaboration. And it was just so meaningful. And I was able to offer a word of Torah too about how it worked together. And so I love the interfaith collaboration, and we'll be looking for more.
Samara, were you going to jump in? No. Okay. So I want to round out the conversation with a couple of high level questions. One is what did we learn from the pandemic, and you know, from the big picture to the smaller level of we will continue to do this, or we will not do that anymore. And then I'll go to my next question. And Samara is having audio troubles, but I will invite her to join us when she can jump in on that. But Leslie, do you want to start with that?
Okay. I think not to be negative, Nancy, but kind of expect things to get worse than they are. We do all this work for things to get better, but I think the pandemic showed us how overnight things can change, and you have to figure out, like, how do you operate in, you know, kind of a worst case scenario. I think another big thing is how much community matters. And I really like what you said, Amy, about aging in community, because all of these federal dollars and all of that stuff, it matters in our day-to-day, and us worrying about staffing and all of those structures. But when it comes down to it, a lot of it is community has to engage in taking care of community. You know, when we do other things like just hold resident events where they know each other and they are integrated into each other's lives, some of the burden of the work is removed to us because they are able to, like, have that community and support each other. And I think creating more of those opportunities is really important moving forward. And even though I say that, I do think more attention has been given to that we have to have these services and these health supports in place before things happen, because the preventive work could have saved us a lot of trouble, because we are still now in recovery from people dealing with that isolation from some of their health conditions worsening from not getting their usual level of care. And I think a lot of great lessons have been learned, and it's brought more attention to the needs of our community, and why these things that we have been advocating for years are so very important.
Thanks, Leslie.
So underscore everything Leslie just said and put squared. I think it's really great. Here's my few, I thought about this a little bit. So first, Harvard, your reports, Jennifer, particularly like to say housing is the linchpin to well-being. I quote that all the time. It's so important. I agree. And I think resident service coordinators are the linchpin to effective supportive housing. So I would say that's one. Number two, I think we should finally stop talking about aging in place and start only talking about aging in community. I think what we saw is how much harder it was for people living in homes, no matter what you brought in, the kind of communal responsibility for each other. And I think everyone who lived with us did better than everyone who lived off on their own. And I think there's a lot of statistics that back that up. We had much lower incidence of COVID, even though it's a communal setting, than people in single family homes in Massachusetts. This next is that place-based strategies are the most effective and efficient at combating both the loneliness and the affordability. And it's not only the affordability for the people who live with us, it's the affordability for society. That's important. And that facilitates the mentoring of the next generation. The third is silos of funding. I always think about, like, oh, the housing people should get more money from the healthcare people. But I realized in preparing for today, it's a two-way street, and the silo makes them less effective than they could be analyzed. So we've got to get over that. And I know your report has some recommendations, which I think are fine. And then the final point is trust. So we've both, Leslie and I've talked about the trust. Our residents have that love. That's great. Now society has to trust us. Because I had spent many years building up some reserve funds for emergencies, I was able to act quickly. By March 10th, we closed the building. Boom, boom, boom. I was only able to do that because I had put money in reserve that was unrestricted, and we were able to use that instantly. For the most part, government funds are so carefully restricted. I mean, I think it took us like 3 months before we got a single dollar from HUD for like some basics. So I think we have to trust providers and have some of that flexible funding in order to be able to respond quickly, and trust that we're going to do the right thing.
Right. So much about what I heard about from you all today is about trust, right? Trust with the residents and trust in the providers, and also that housing is the community. It's not right. It's that this is the important message. And poor Samara is struggling with her audio, but she's hanging in there with us. And Samara, if you have anything, you can add it to the chat for sure. Oh, we just lost her. There was one comment I just want to make sure I bring up in the question and answer, that a lot of these models can be extended to people with physical, intellectual, or developmental disabilities. So something that we definitely want to keep in mind as I ask the last question, which is, what would it take to ensure that more senior housing properties could offer service coordination and the rich kind of services that both of you have talked about? And to some extent, you just answered, some of those questions, Amy. But where would you put your priority? If you could wave a magic wand, where would you go?
Healthcare dollars and housing dollars would be integrated, and people who came up with clever ways of providing both more efficiently than they would independently and with better outcomes. Let that go wild.
Yes, I agree with creating more buildings that have those integrated services. I would love to see both healthcare supports and community supports in buildings that are accessible for our older adults. Another thing that I'll note is one of our contracts is with our county disability services office, so that they dedicate staff and being able to come into our senior buildings to make sure that they are accessing the services that are provided through them being disabled.
Well, if there are any last thoughts, please share them. Otherwise, I definitely want to thank all of our guests. Amy, go ahead, please.
So one of I just saw a question which is saying that the low-income housing tax credit program, in fact, people pay more than 30%. And what can we do to change it? The tax credit program needs a massive overhaul so that it can allow you to go deeper and to charge lower rents. I won't even tell you which municipality we're having arguments. We like to subsidize our tax credit rents so we can go lower, and we're getting a lot of pushback. So to answer that person, oh my gosh, we've got to all get together and recognize the tax credit program serves a tiny sliver of the need, and we've got to get back to the 202 and other programs that create those vouchers that make much more sense.
Mm-hmm. Thank you. And just, I guess I also want to bring it back to another webinar listener has a comment. Oh, that just jumped off my screen. Hang on. Which is that the pandemic did bring us a lot of resources, right? And the very fact that we had eviction moratoria, led by the CDC, really, I think, spoke to the fact that we all believed in the importance of housing to people's health, to stable, safe housing to people's health. And there was a lot of funding around for other aspects of this, and donations of technology and all that. So I think this is really useful to imagine, even with the challenges that you both described, what is possible when we adequately fund things and we put our priority on safe, affordable housing right out there. So I don't know if, we're kind of leaving that phase now. And so if there's any thoughts that you have on that.
Leaving that phase, meaning the eviction moratorium and stuff.
Yeah, and having those emergency funds and the PPE funds and all that, right? I mean, that certainly, I think wasn't. I mean, a lesson was that we can do this, right?
And I think what Harvard study, the study you guys did, proved how effective it was and how efficient it was, compared to. I mean, if we didn't have people getting COVID, so they weren't going into the hospital. And since our people are all over 85, they would have cost a lot of money. So recognizing that efficiency, we've got to capture it going forward. And your report talked a little bit about zoning changes and advocacy, and I think it's so important that we recognize there shouldn't be a 26-year waiting list at our place. That's unconscionable. And it's not good for society, and it's not good for the public purse, so.
Right. Leslie, there was one final question, so I'm going to leave you with the last word here, which is that nonprofit providers of housing are fundamentally different from housing authorities. And, if you have any thoughts on the particular challenges or opportunities you might have.
Yes, thank you, Kathy, for that question. I actually was surprised that we struggle with that in Seattle, which is a city with a lot of major, big, especially tech employers. And I thought, oh, this should be a great resource to be able to access funding. And I think it's that weird space of being kind of a quasi-governmental agency. And, the reality that a lot of those donated funds, they want to give directly to the nonprofit. So, I think one of my strategies is we have to develop those partnerships with the people who are getting the dollars, and, working on our residents being the target population that they use those dollars for. So I think that not being committed to being the person who has to get the check, but being the person who says, but I just care that the people are served. If the check needs to go to someone else, that is fine with me. But what I can provide is that you have this space, you have this audience. And I think that is still a benefit for those nonprofits and others that we work with to want to serve the residents that we have.
Thank you. Thank you, Leslie. Thank you, Amy. Thank you, Samara. Really appreciate everyone's time today and all of you out there for joining us. Just a reminder, the next webinar in this series on our learning from COVID, lessons from COVID for supporting older adults is on December 8th. And we look forward to seeing you there. Thanks again, everyone. Have a great weekend.
Thank you, Jennifer, for all your great work over the years.
Thank you.
Yes, thank you so much.